Communication is the imparting or exchanging of information or news. Communication is usually defined as a transmission of information. There's a sender and there's a receiver. There should be understanding of what is being sent, what the message is. When we communicate, we want to ensure that our message is clear. We want to ensure that our tone is a friendly tone and not aggressive. We want to ensure that the things that we say will be received as intended. An example of aggressive behavior when communicating is Bob asked the nurse to assist his daughter, who is in a long-term care facility due to various health conditions, for assistance with getting dressed. They're going out for a family dinner. And the nurse responds, go ask someone else to help you with your daughter. I'm busy with another patient right now. That response is inappropriate and will be deemed as aggressive. Active listening involves the person allowing the other person or others to speak uninterrupted and respond appropriately to the discussion. It also entails the person that paraphrases what the other one have told them to ensure that the message that was sent was actually received. In addition, the person that asked questions, be sure that they understood what was said correctly. Make sure that the intent and what was being communicated was understood correctly. Effective communication is, for an example, if you're taking care of a client and they did not, you notice that they're not eating their breakfast like they normally would. They're any meal. They normally go out to an activity and that has changed. You're noticing they're staying in their room more. And you are in a conversation with your client and you say, I noticed that you're not eating your meals like you used to. Is there something else you would prefer? It could be that they have a change in appetite, or it could be that it is something else going on. Also, you could say, I noticed that you're not going out to the activities. Is there a different type of activity that we should offer? This is demonstrating effective communication. The major difference between an LPN and an RN is the registered nurse formulates nursing diagnosis. The Institutes of Medicines define patient-centered care as providing care that is respectful of and responsive to individual patient preferences, the individual needs, and the individual values. SBAR is an acronym for situation, background, assessment, and recommendation. It is a technique that can be used to facilitate prompt and appropriate communication. It ensures that the communication, whether it is verbal or written, is you're giving the essential and the information is concise. If we are discussing a patient's goals of care, orders that need to be addressed, procedures that must be done, or diagnostics to be reported, we are referring to the recommendation part of the SBAR. Functional nursing is care treatment that is divided between staff members according to the task. As a LPN, you will not be the nursing supervisor for an acute care facility. You will not deliver discharge instructions, and you will not complete all of the admission assessments. These are for the RN. So remember your nursing process. If you are reinforcing follow-up care for a client, they have a take-home folder that includes information about nutrition, their diet, information for weight loss. You are displaying the teaching and learning, which is the basic nursing process. Sexual harassment is frowned upon. It is inappropriate, and it should be reported immediately to the supervisor. You want to follow your policies and procedures at your workplace. So some examples of sexual harassment is if an immediate supervisor asks you to meet them for a private dinner or a private party or a private bingo game or card game at their home. Sharing or making sexual jokes within the workplace. These are all inappropriate and is considered sexual harassment. Sexual harassment is the unwanted sexual references either directed towards one from another or overheard in a workplace between others that makes someone feels uncomfortable and interferes with the ability to work.